Physicians use various imaging methods to diagnose breast cancer. Mammography, ultrasound and MRIs provide different information the physician subsequently consolidates. Here at the Fraunhofer Institute for Medical Image Computing, researchers have now developed software for this. With Bridge, it's now possible to show multiple breast images in one breast model. Mr. Zöder, what challenges does a radiologist who wants to combine the multiple imaging findings face? Modern breast cancer diagnostics typically utilize different modalities. Each one has its own distinct advantages, but the female patient is mapped differently with each of these modalities. During magnetic resonance imaging, she lies on her stomach, during an ultrasound, she lies on her back, and during mammography, she's standing up and the breast is clamped between two plates. The different positioning also causes the breast tissue to be pictured differently in the images. The radiologist needs to consider this if he wants to compare different images and determine the position of a tumor on another image, for instance. You have now developed a solution for this. What does it look like? Prior to our solution, all of the images lived in their own world, such as the world of mammography screenings or the world of MRIs. Our method intends to bring all of these images together in one shared world. It works like this. In this mammogram, for instance, you flag a position that's then transferred into our breast model and from there automatically into this MRI scan. Here is a conspicuous lesion, for instance, which I click on and can then see the respective location here on this MR image. It lights up. What concrete advantage does this provide the physician? The physician no longer has to consider this complex breast deformity. Prior to this, he needed to mentally transfer the location from the images in his head to the other image. This is now done by the software. He also no longer needs to scroll through big amounts of three-dimensional data of the layers. Of course, another advantage is that reporting is made easier with our solution. How exactly is reporting being supported by this method? Our software already transfers the position in the images into our unified breast model. If the doctor finds something conspicuous, he can simply specify the positioning and then transfer it into his report. Researchers at the Fraunhofer MEDICA have focused on breast imaging for many years. During the Bridge development, they initially started with mammogram images and then expanded the software with 3D ultrasound and MRI data. To put this into practice as quickly as possible, the scientists utilize different skills. Dr. Joachim Georgi oversees this project as an information scientist. Dr. Georgi, what technical requirements need to be met to integrate Bridge in a radiology department or at a hospital? Right from the start, we designed Bridge so that it's easy to install the system into existing computer systems in a radiology department or hospitals. It's a so-called plug-in for existing software, which is very easy to control. What are the next steps in your project? In a first step, we want to jointly conduct evaluations with clinicians and radiologists and gather experience about the daily use of this software. We would like to find out how much time radiologists can actually save by using this system. We're also in contact with major manufacturers of software systems with whom we could distribute this plugin.
Herstellern sind von diesen Softwaresystemen, von Computersystemen und so dieses Plugin dann darüber auch vertreiben können.